Ciao, my name is Ashkan. I was born and raised in Italy from Persian parents. I'm here today to talk about my story. I had my first knee surgery when I was 17. Following 7 years, I had another 4 surgeries on the same left knee. I used to play soccer for my university. In Italy, I was playing for a club for many years. I kept pushing and playing because that was my passion. That's still my passion today. When I turned my other knee for the first time last year, back in 2022, I knew that this surgery will be tough. It will be again one of those surgeries that will take a long time to recover, a lot of pain and so on, but I made that decision to do it because I have 2 small kids and I wanted to keep playing with them. I got lucky enough to be introduced by my friends to Dr. Thomas Nau. We both knew I need surgery, so I didn't need any convincing on that part. I just didn't know when would be the right time.
I met Ashkan first time in December 2022 when he came to me after a right knee injury where he sustained an ACL tear that causes instability and pain in his knee. He is a very keen sportsman, so he had another ACL injury on his right knee. We diagnosed that. He had functional instability. That means he couldn't stabilize the knee with secondary stabilizers like muscles anymore. And it was clear to me that the only way we can really help him is surgical reconstruction.
Speaking to him, he gave me a lot of confidence that he's the right person to help me out. We decided to do the surgery in January 2023. King's College was awesome. You almost feel like you're in a hotel. The room, in terms of the nurses, in terms of the organizations. Surgery went awesome. It took maybe around 1 hour and a half, 2 hours. The first feeling I had when I woke up was incredible, just because I was able to get up on my crutches, go to the bathroom on my own, and that was on the first day. And already, compared to my past surgery, it was a huge difference.
Over the last years, we've supported with some experimental and also translational research. I have perfected, I think, this ACL reconstruction method, minimal invasively, with a graft that we use as ligament replacement. We take it from the extensor side of the knee, from the so-called quadriceps tendon. And this has been shown to be a very effective method, very stable, with a very short recovery. Ashkan experienced exactly like this. The surgery went very well. The surgical time takes about 45 minutes, not longer than that. If you have to do some additional meniscus work, it takes maybe a few minutes more. Ashkan recovered very well after that surgery. He could leave the hospital on the same day. He's mobilized fully, completely, straight away.
I went home, kept myself independent, didn't need the help of anyone to help me do the stairs or sit on the couch. I started the physiotherapy after a week. When I was 1 month into physiotherapy, month 3, month 4, it was incredible. That made me happy. That made my transition from being hospitalized to work to do a normal life much faster than I ever thought or than I ever experienced in the past. I even recommended Dr. Thomas Nau to a couple of my friends. They had the same results that I did. I think doctor is a magician. I call him a magician every time I see him. He laughs at me, even if he's Austrian and very precise, very firm to what he says. For sure, vouch for him. I vouch for the hospital. I vouch for the type of services that we got, for the precision of the procedure that I had. And today, I'm sitting here after 9 months, being fully able to do any sports that I want, with no pain. I'm playing with my kids. I'm enjoying my life back to normal again.
Overall, I'm very pleased with the surgery, the quick recovery, and the functional outcome of the patient.